Hi, my name is Stephanie Hertz, Marketing Director at Warwick Forest Retirement Community. Warwick Forest is the premier sponsor of the Lifelong Learning Society, and we welcome you to the Riverside Lecture Series. Today, I have the pleasure of introducing Mr. John Vaughter. John Vaughter is the Certified Driver Rehabilitation Specialist and a licensed commercial driving instructor. He holds a Bachelor of Science degree in Physical Education from Norfolk State University and a Master of Education degree from the University of Pennsylvania at Westchester. He has been credentialed as a Certified Driver Rehabilitation Specialist by the Association of Driver Rehabilitation Specialists since 1995. Mr. Vaughter was honored by the Drive Safe Hampton Roads organization as the recipient of the 2021 John T. Hanna Lifetime Safety Achievement Award for Outstanding Service in Transportation Safety. Mr. Vaughter retired from the Hunter Holmes McGuire Department of Veteran Medical Center in Richmond, Virginia, as the Driver Rehabilitation Program Manager in the Department of Physical Medicine and Rehabilitation Services. Today, he'll be talking about evaluating the driving potential of older adult drivers. Please give a warm welcome to Mr. John Vaughter.
And thank you so very much. It's just a supreme pleasure to be with you all this morning, as it always is. And I always like to start the presentations by just saying a little something to kind of lighten the load, if you will. Just listening to that Stephanie, I'm saying, gosh, man, she's kind of telling my life story here. But it was just a real opportunity that was presented to me as I worked in the Department of Veterans Affairs. And I was telling an individual I was speaking to just about about a half an hour ago, about his son who had a traumatic brain injury. Okay, and his son was about 27 years old, and you can about imagine that he's been pent up, locked down actually, for the last 6 months. And I mean, he's really chomping at the bit. But it really is a pleasure just to speak with you all because gosh, I'm going to date myself here a little bit, but I've been doing this for 40 years. And in the Department of Veterans Affairs, I had the opportunity to just literally travel across the country doing presentations with regards to just the issue of getting individuals back behind the wheel who've been injured, just like this young fella had been. In fact, he was injured by running off the road and hitting a tree. So ended up with a traumatic brain injury. But what is most interesting, has been most interesting, is that working with the Riverside Hospital System up in Williamsburg/Hampton with the Center of Excellence in Aging and Geriatric Health, then had the opportunity to work with any number of seniors with regards to getting them back behind the wheel. And you know, the thing that's so most interesting is the fact that when individuals see me coming, they think that I'm going to actually take their license. I said, no, number one, I don't work for DMV. I just do evaluations for DMV, okay? And I said, and by the way, I'm here to try to keep you behind the wheel. So that is really the essence of what we're going to talk about this morning. And I just want to say this too, because I already let the cat out of the bag by indicating that this young fellow, I mean, we see individuals literally from the age of 15 years, 9 months, okay? Youngster trying to get their license. The oldest one that I've had was 103 years old. I'm telling you. Now, that really didn't go over that well because, again, like I said, I don't take individuals' license, but if I do my evaluation and I find out that the potential is not there to continue driving, guess what I have to do? I have to retire them from driving. And to be very honest with you all, the vast majority of the seniors that I see, and I'd say probably to the tune of 90%, I can find a way for them to continue driving. Because with the DMV, and you'll see as we get more into the presentation, the DMV allows us to do all kinds of things insofar as trying to keep somebody independent. Because the deal is that if you lose your independence, guess what else you lose? The quality of life. And when that happens, I mean, that's kind of going back to the VA now. I mean, I've had youngsters probably, mid to late 20s who've been injured, spinal cord injured, or traumatic brain injuries, and all kinds of things. And I mean, I've literally had them to tell me that, everything's not for everybody. So if somebody's not have good potential to drive, then, we have to do what we have to do. And I mean, I've had a number of them say, well, John, I might as well just go right behind the house and just, what? And I said, no, don't do that, because guess what? We can find a way, hopefully. But yet at the same time, if we can't find that, we have to do what we have to do. So what we'll do here is that I'm going to be talking about a lot of information. And generally, we'll usually have a Q&A at the end of the discussion presentation. But if I say something and you see something that you say, oh, gosh, what about that? Just kind of raise your hand and be identified, and we'll try to answer questions as we go through the presentation, okay? So we're here to talk about assessing the driving potential of senior drivers. And I've heard many, many times over how senior drivers are really and truly good drivers, but yet there are some things, and I've had a lot of them that tell me, well, John, I've been driving for 50 years. But, really appreciate that, sir, ma'am. But the idea is here that maybe you didn't have that medical condition 50 years ago. We're talking about here and now. And the other thing that's so interesting is that when I got started back in the day, we were really just concerned about the driver, okay? It's not that way anymore. Now it's more what? Public safety. So we have to obviously be concerned about the driver, okay? But at the same time, we have to be concerned about the other users of the highway system, which gets kind of crazy. In fact, talking about crazy, I live in Richmond. So obviously to get down here, I've got to get on 64. I know you all may or may not know where Bottoms Bridge is, but that's where the race starts. Okay. And I mean, when I get on 64, it's like pedal to the metal, And then you got, the ones out there who really and truly want to do the business of getting down the road faster than I want to. So that brings up another issue as well. Want to just mention too that you see my son's name obviously under mine here, and he's a certified driver rehab specialist. And I was telling Mackenzie, I think I was telling Mackenzie that, we're all over the place, because you can believe this, it's less than 500 of us in the entire United States of America. So in saying that, let's see, today is Friday, and Wednesday, he was in Baltimore, Maryland. Tuesday, I was in Virginia Beach, Chesapeake, and Norfolk. And in fact, next Wednesday, I got to go to Hamden, North Carolina. Been down to Elizabeth City. So anyway, long story short, we go from our territories, we have privileges in Southern Maryland, Northern Virginia, Central Virginia, Eastern Virginia, and Northeastern North Carolina. So we kind of carry a big catchment area. So what was I going to say here? So with that being said, I'm going to try to figure out how to do this thing here. Next slide here. What do I do here going forward? Okay. Some learning objectives, of which I've already just kind of touched upon. And that is, we're hoping that you'll learn about the role of the driver rehabilitation specialist, what we do, how we do it, insofar as keeping individuals safe behind the wheel. You'll learn about the tools that we use, the testing that we use. And it just kind of goes on and on and on and on. It never ceases to amaze me. Like I said, I've been doing this for 40 years, and guess where I'm going to be next Friday? Charlotte, North Carolina, to attend a conference. And I'm telling you what, going to those conferences is always something that's going to be a learning experience. So I guess you never get too old to learn. So obviously also about the Department of Motor Vehicles. You're going to learn about the various policies in regards to what they have, what they've implemented through the Medical Advisory Board, which is a team of physicians, that is, okay? It always amazes me, because sometimes I'll say to a client, we got to refer your case to the Department of Medical Review Services section. What? That's a DMV section that monitors all medically impaired drivers. Guess whose monitored by the Department of Medical Review Medical Service. Yours truly. See, because I've got a restriction with regards to my glasses. If I take my glasses off, I don't meet the state standard. I put them on, I do. So as a result of that, I'm sure I see some folks in here who have glasses on, and then some of y'all might have contact. So, but the bottom line is the same. So in saying that, I mean, it's all kinds of policies. And that's in a way in which we can actually keep an individual driving, because there are all kinds of restrictions, just like my glasses. If you just use that as an example, I can restrict someone to drive for as little as a 5-mile radius from their home. Some people will say, well, John, what in the world is a 5-mile radius going to do to someone? Well, it depends on who you're going to ask. Because most individuals in the senior population, they got their routine route that they travel. And it's not driving up to Richmond every day, no, even to Norfolk, but it's usually within a certain boundary from their home. And most people don't, number one, they don't even know that the medical review service section even exists to start with. And in fact, as I'd spoken with Mackenzie this morning about this young fellow that I have up in Richmond who has a traumatic brain injury. And I was speaking with his dad, and his dad was saying, well, John, we need to do this and we need to do that. And the doctor doesn't want anything to go to DMV. Huh? No, we don't operate like that, because see, there are policies that govern, monitors individuals who have had traumatic brain injury. And as I was telling him, I said, the list is so extensive. The easiest way that I can describe it is just simply to say, for medical conditions, from A to Z. Now, if somebody can pick whatever situation that they have, then I can isolate that and exploit it and explain to them what we need to do because of that particular situation, okay? All right, let's move on here. Now, as a certified driver rehabilitation specialist, guess what? There's some hoops that you have to jump through to get that credential. Number one, you have to have a degree, okay? The degree could be in any rehabilitative field: physical therapy, occupational therapy, kinesiotherapy, and even you got some recreational therapists, some speech pathologists. I mean, the list goes on and on and on. Now, for an example, like my son, what the difference is based on your degree, that means you have to do what? Touch more bases with regards to the internship process. So he's got a master's degree in sports management. Well, how in the heck does that relate to some rehabilitative field that this person is trying to get to? Well, easy. He's got to spend a lot more time doing his internship. And plus, he has to take some additional prerequisite courses to obviously qualify to take the exam. So just proud of him and his accomplishments, because again, like I said earlier, it's less than 500 of us in the United States of America. And obviously myself and him, we are two of that number, okay? It's an international organization. We've got individuals, for an example, we'll see next week, obviously from here, 50 states in the United States, Canada, and the United Kingdom, okay? In fact, I've been going to so many conferences, guys. I'll tell you what, it was, I don't know, 8 or 10 years ago, we had somebody from Australia. Then we had a few people from Japan. So the organization is actually growing. And as Stephanie had mentioned in the intro, I took the very first certification exam in 1995. So things have been kind of percolating all along. But you're going to have a thing of attrition, because obviously people have retired and moving on and doing other things, okay? I was just saying at the bottom of the bottom bullet, it says approximately 500 certified driver rehab specialists in the United States. Okay, now what is a certified driver rehabilitation specialist? And the thing that's so interesting is that let me kind of rephrase that. When a physician, nurse practitioner, or physician's assistant finds out about us, good grief. For an example, about 3 weeks ago, I had an ophthalmologist call me, and he said, John, I've been trying to get in touch with you for the past 2 weeks. I said, well, welcome to the club, because everybody's doing the same thing. Well, as an ophthalmologist, he was saying to me that he has any number of clients who have had a stroke, seniors, okay? And not only just seniors, but just generally across the board. And he was saying, what is the DMV's policy with regards to individuals who've had a stroke and who has what? Visual deficits, okay? And I explained to him in short, because I mean, I guess I must have been on the road somewhere, but I didn't have my little cheat sheet with me to really break it down for him. But I said, I can tell you one thing, once an individual, for an example, has a stroke or any head trauma, if you will, number one, we have to have the physician involved. And then we got to have what? An eye care specialist. In this case, it was an ophthalmologist, could be an optician, optometrist, et cetera, et cetera. So he was saying, well, how in the world and what in the world do I do? I said, well, Doc, all that you do is when you get somebody, refer them to us and we'll take it from there and I'll guide you along the way. Thank you, John. So see what we literally did for him, as we do most other physicians, is kind of help them along the way or her along the way so that they can better serve their clients or their patients, okay? So we do just a multitude of things, such as we can do our program administration, obviously, and then we do our clinical assessments. And we're going to talk a little bit more about that in just a minute. We perform vehicle assessments. And I'll show you in the slide here where this whole business of driver rehabilitation has gone from the time that I got started. It was really a function that I could basically tell you just about everything you need to know about what? Adaptive equipment. We'll talk a little bit more about that. But it has gotten so now with the technology as compared to how it was back in the early 80s, can't keep up with it anymore. I've got to get on the phone and call the what? Manufacturer or vendor. And I'll say, yeah, what about this? For an example, last Wednesday up in Williamsburg, I had this gentleman who had a 2022 Genesis SUV. And as I'm talking on the phone to him, getting him scheduled, I said, you know what? I've seen these vehicles. It's kind of a new kid on the block, if you will. And let me tell you, it is really the new kid on the block. This gentleman had, because I had to ask him, I said, what in the world? It's a Genesis. And then I noticed on the back end of the vehicle, it's a GV80. That was awfully interesting. So I said, let me take a look in this thing, because he needed hand controls, and he was late 70s, early 80s, and he had a severe case of neuropathy. So he's telling me that John, my wife and I, we were driving down to Florida, sometime early in the year, during the summer. And he was saying, I'm driving, and as I'm trying to touch the gas and the brake, he said, I couldn't feel. So then he said, at that moment, I pulled over, told my wife to drive, and guess what? His wife had to drive all the way back from Jacksonville, Florida, all the way back up to Williamsburg, because he was just so afraid to drive for good reason. Well, anyway, excuse me. So anyway, on this Genesis, he called a vendor down in Norfolk, Mobility Works, to find out if, in fact, they could install hand controls on this new vehicle. Lo and behold, the vendor had to call the manufacturer in Canada to find out if, in fact, this could happen. Because, you know, come on, everybody on the street, they don't have that Genesis, which is a kind of a high-end car, right? Right, I mean high-end. So anyway, he calls up, the vendor did, calls up to Canada, in fact, called the same company that we use a lot of their equipment. And they said, yeah, we can install that equipment. So needless to say, now he's happy, because, I mean, what was he gonna do? I mean, gosh, I've got this 2022 Genesis, and I can't drive it, obviously without hand controls. So now with the hand controls, he's gonna be able to do what? Drive just like he's always driven. The only difference is gonna be now that he's gonna be doing what? Driving with hand controls. And we're gonna talk about that a little bit later on. But anyway, what I'm talking about, hand controls actually handles the gas and the brake. So in other words, you don't have to use your legs, your feet at all, okay? So let's see, where are we here? Now, we also, in this particular case, the last bullet, recommend final driving recommendations. And there are all kinds of recommendations that we can recommend. For an example, just like this gentleman, he will have to go through additional testing at the DMV based on the fact that he's doing what? Using hand controls. Now, the thing of hand controls, if you could remember, or talking about the glasses, the visual acuity. So see, the same idea can be related to his using what? Hand controls. And now his license will be coded, okay, just like mine is. some of you all obviously might have the same code to show that he's been approved to drive with what the hand controls. All right. Now, DMV certified programs in Virginia, the Capital Driver Rehabilitation Consultants. That's my son and my business, of which I was just telling you about. And also, we do run the Riverside program up in Williamsburg and Hampton. The VA hospital, Richmond, of which I retired from a few years ago, after a few years, and then the one in Hampton, okay? Now, Woodrow Wilson Rehab Facility up in Harrisonburg, Inova Hospital Systems. And I just found out, actually about 3 weeks ago, they had a program up at the University of Virginia. And that program was no longer in existence. And like I said, I just found this about 2-3 weeks ago. So now that's going to be another area in which we're going to be slammed with regards to taking care of individuals up that way. And certainly there's several private practitioners who, I think at last count, I believe it was maybe 4 or 5 private practitioners, because most individuals are working at rehab facilities and also hospitals, okay? So they don't get to go out and do like we do, traveling all over the place, okay? Now, we're talking about referral sources. So how do we get referral sources? All kinds of ways. Generally, they come from the physicians, nurse practitioners, or physician's assistants, also from the DMV Medical Review Services section, obviously at the headquarters up in Richmond, DMV headquarters. Again, hospital and rehab facilities, and private practitioners, again, physicians, nurse practitioner, PAs. And in a lot of cases that we get come from the courts. And now watch this. This is another one that's really starting to gain some steam. And that is, if a police officer observes someone driving sort of erratically, okay, not doing what needs to be done, they can pull that person over, obviously, right? Now, when they pull that person over, they'll go through their little routine and try to figure out what's going on. Another little story here. This happened about 20 years ago. Young lady, I don't know if y'all know where Beaver Dam, Virginia is. But anyway, you got Ashland here, and Beaver Dam is over in the thickets, okay, from Ashland. Well, this lady was up in her age, and as I remember, middle 70s, early 80s. She was on her way to Ashland to do her shopping, as she's done for many, many years. Well, unfortunately, this was around the time that we're going to experience here in the next couple of months here. Time goes back, so now it's dark at 5 o'clock. So she get caught in that situation, and then there's that episode of her becoming confused. She ended up in Lynchburg, Virginia. Now, she got up to Lynchburg, and by that time, she's figuring out that, wait a minute, something is not right. So she pulls over out of the road. So now guess who comes along? Police officer. Police officer comes up and taps on the window, and just trying to find out what's going on. Well, the individual was so confused that she just flat didn't know just where she was and what was going on. So in other words, they obviously called it EMS, and they took her to the hospital. Well, ultimately what they had to do was to call back to Beaver Dam, get her family to come up, 2 persons, okay, to come up so that they could get mom. Now, when they got mom, obviously one person drove the car back, and then the other one drove their car back. But anyway, she was automatically suspended, because what that police officer has the authority to do is to issue what I call an unfinable ticket, a ticket that obviously is no charge, no court, anything like that. But guess what happens? It goes to the DMV Medical Review Services section. Based upon that, that person's going to get a letter in the mail, and I call it just a nastygram. And that's a letter indicating that, sir or ma'am, your license is suspended. You must now go to driver rehabilitation to be assessed, to kind of see what's going on. Now, when that happens, guess what else we have to do? We've got to get the physician, nurse practitioner, or PA involved, because now they've got to complete a form, which is a DMV customer medical report, okay? Now, my job is to do my testing just to find out just where that individual is with his or her cognitive status. Once I find that out, then I can go about the business of saying either this person can what? Go back to driving, or we can do some restricting. Okay, remember we were talking about the 5-mile radius. We can do up to 25 or unlimited and all the other restrictions that we can find. So that's how we can actually help these individuals maintain their independence. Because like I said earlier, the thing that happens when you lose your independence, quality of life goes down the tube. That just creates a bigger problem than a person, what, driving right around their general area, of which they probably have been driving around forever and ever and ever, okay? All right, let's see. Now, our clinical assessment, it involves quite a bit, just depends on the situation of, gosh, I probably got more stories than Carter got liver pills, but anyway, doing our assessment, we use these testing protocols, mini mental testing, mini mental status exam, a Montreal cognitive assessment, okay? And all of these tests are done to determine just what one's driving potential is, okay? Now, once we find that out, then we will what? Isolate a particular, what, driving scenario to suit that individual's needs, okay? And it's pretty much just a function of just doing the testing. After we do the testing, then we will go ahead and see how that individual is driving in that respective environment. Another little story here is I had an individual up in Williamsburg about a month and a half ago, 84 years old. He came in and to the center. And what I didn't realize until actually I'd gotten started doing the evaluation, our office manager came and said, "Oh, John, by the way, got to tell you that you might want to know this, that the young lady drove in as somebody led her from the retirement facility to our facility." Well, that's pretty strange. Why somebody would have to lead somebody in? So the red flag goes up. But no, I'm going to continue with my testing. Lo and behold, the individual did fairly well on the testing, but not well enough not to be restricted. And not so bad that we would do what? Say retire from driving. So anyway, we go out and do our final drive with her, which would have been in a, what, 10-mile driving radius, okay? And when we got back, I said, "Ma'am, is everything okay with regards to your getting back," and so forth and so on. And I'm just saying that because of what was told to me. Well, the little man in the back of my head said, "John, you know what? Maybe you better follow her." Well, I knew of the retirement facility, but I didn't know exactly where it was. All I did was just punch it into my GPS, and I said, "I'm going to follow her." So off we go down through Williamsburg. Oh man, she's driving pretty nicely, okay? So after we leave Williamsburg proper, we're going down Route 5, and my GPS is telling me left turn next street. Well, when we got to that next street, kept driving. Well, maybe she knows a way that I don't know. About another mile and a half or so, GPS comes up, left turn next street. Kept driving. I said, "Oh, now I know she must really know something that I don't know, but I'm going to give her the benefit of the doubt." So we drove now about another 2 miles or a little bit better. GPS announcer came up, left turn next street. He kept driving. I said, "Holy mackerel." I said, and I know Route 5, yeah, kind of, sort of. So we drove 8 miles from that third left-hand turn that she was supposed to make. And we got up, if some of you all know Route 5 area, up by the James River, you got this little bridge that you go across. So now she's figured out that what? Something's not right. So now she turns off. Now I'm having to turn. And now by this time, when I turn, now we're side by side. When she rolled down her window, because now I got my window open. To this day, I don't think she knew who I was. And I had just completed a full comprehensive assessment with her. And I said, "Mrs. So-and-so, I'll lead you back to your retirement facility." Now I've got to turn around and lead her back, which was another, that last turn, left turn, was about 8 miles that we had traveled beyond that turn. She had totally forgotten where she was. So when we got back, I said, "Okay, now you need to retire from driving." because she had lived in that retirement facility, and I can't remember exactly, but it had been for, quite some time. Now, if she did that in daylight, unlike the lady who I was telling you about, who was driving from Beaver Dam, Ashland area, all the way up to Lynchburg, that was during the time that the time had gone back, and she'd gone from dusk dark to, total darkness. This was in the middle of the day, okay? So which meant to me, and see, a lot of times seniors, again, they can navigate a particular environment, okay? Because what? They've driven in that environment for quite a period of time. But the whole thing about it getting dark, now we change the whole scenario. Because that scenario of darkness can really produce some problems, cause some problems, okay? So, but anyway, just telling you that story, that's one of the instances that I just flat said that, and she had just told me, yeah, I know how to get around Williamsburg because I've been here for da. And now I said, no, if you do that now, guess what else? If you're out there driving, you're gonna get into trouble. Well, what I didn't realize is that she had to have someone to lead her to the office and then to come back and bring her from the office back to the facility. What is that telling me? Yeah, So anyway, we had to retire her from driving. Okay, just as we had to do with the young lady who ended up from Beaver Dam, Ashland area, back up to all the way up to Lynchburg. So again, these are just some of the tests that we use, and these are a lot of tests that it's just kind of neuropsychological kinds of tests that's done, and it helps us to determine just where one should drive, and in fact, if they should drive at all. For an example, yesterday I was in Hampton, and this young lady had a mild case of, some people's mild cognitive impairment, dementia, Alzheimer's, the whole list goes on and on. On the mini mental status exam test, very first bullet, the highest score you can get is 30, okay? He scored a 19. Any score at or below 24 indicates a very high likelihood of cognitive dysfunction. And see, and I tell people all the time that what we can do, I'm not the doc, but guess what I can do? I can confirm that diagnosis that the doctor has obviously given that individual based on the score, okay? And then with the, where's it, clock, is that up there? The clock drawing test, the second one from the bottom. I had an individual, a couple weeks ago, scored 2 out of 5 on that test. 7, excuse me, 2 out of 7. I thought I saw another hand. No questions? Okay. But yeah, we do, see the trails A and B, visual perceptual testing. That is one that's, I'll call it the eliminator, okay? That test is, I'm telling you, it has stood the test of time because visual processing with individuals in our senior population, unfortunately, I can pick it up very quickly. And that being able to pick it up, I do it from the tests, A and the B, okay? So the A is, if you can imagine, sheet of paper, it's got, and I call it just a scattergram of numbers 1 to 25. And the reason why the numbers are scattered is because of the fact that no car is ever in the same position. So that means you have to do what? When I give, and it's a time test, by the way. So when I give them the go, they have to connect all of the numbers in numerical order from 1 to 25, okay? Most of the time, for an example, just yesterday, I had a lady to score in the 90th percentile, and I forgot her age. She was on up in the 70s. No, I take that back. She was 81. Okay, now watch this. So 90th percentile. So all that means if 10 people took the test, only one's gonna do better than you or her, okay? But when we did the trails B, guess what this is? That's a divided attention test because now you have to go from what? A number to an alphabet. And then the numbers of alphabets are scattered across the page, just like they would be if you were driving out on there. You all bear with me. I'm from Richmond, by the way. So I know where Jefferson Avenue is. I think it was the Coliseum and I don't know, a couple of those big streets, okay? And then obviously you got the big old 64, all right? So that would be an example of driving in that environment, all right? So in other words, what you have to do on the word go, you have to go from 1A, 2B, 3C, 3C, 4D. He scored in the 10th percentile on that. So how could you see such a wide separation from the two different scores? So that would tell me right there that, hey, I don't want you nowhere near 64, okay? And in fact, it really worked out because she lived over in Newport News and she only drove within a 5-mile radius of her home, never getting on, obviously 64, because she didn't drive that on 64, nor drove at night. And she just drove whenever she needed to go to the store, to church, which was really within that 5-mile radius, okay? So that's how we can kind of eliminate somebody getting into trouble, because if she got out into trouble, get into trouble, she would get into trouble out on 64. One more story and then we're gonna move on. This happened about 5 years ago. I had this lady up in Williamsburg. She was, immaculate dress. She was just a peach. She was about this tall. We're sitting across the table from one another, right? So we're doing our testing and she got to the Trails B and she totally bombed out. Did really, really well on the A version. So I looked at her, Ms. Davis, just like I'm looking at you. I said, well, ma'am, based on your performance, I don't think you need to drive on 64. He looked right back at me across the table and said, Mr. Vaughter, how in the world do you think that I'm gonna get to, this is like about April timeframe, how do you think I'm gonna get up to the University of Richmond to celebrate my 65th class reunion? I said, man, I looked right back, I said, did I ever say anything about you not going to your 65th? I said, I didn't tell you that. And then I said, okay. Then I looked right back at her and I said, have you ever heard of Route 60? And then that kind of broke the ice. And I said, well, I bet you have, because Route 60 was there long before Interstate 64. And in fact, I said, you know what? A lot of times when I'm in Williamsburg or Hampton or Tidewater, and I want to take the scenic route, guess what route I take? 60, because that's a nice little quiet out in the woods back in there, you can take your time. And then she said, well, I know that route well. And like I said, I know you do, because I know where the university is. In fact, I don't live far from the University of Richmond. So you see how we can do that? It was a very touchy situation at first, because she was going to go for my head. But then I told her, because of the fact that her visual perceptual processing speed, come on, up in age like that, it can't be the same thing like it was back, 65 years ago. Fast moving traffic. That's under normal circumstances, because most time when you get out there on 64, when I get on that Bottoms Bridge, the speed limit is 70. Get down by Fort Eustis, I think it drops down to 60. But do you think anybody's doing 60 or 70 out there? No. People are going all over the place. So in other words, she's got, or anybody that doesn't do well on that Trails B, I can pick it up from the standpoint of just what your visual processing speed is. And if it's not, and I've got a chart that I go by based on one's age, just what that number should be. And I've never been, Ms. Davis, one for math, but I'm telling you, since I've been doing that with all these percentiles, now I'm a stone believer in what? I'm telling you, show me the number and I can tell you what somebody should or should not do. And that's for their safety, okay? All right, let me see, how we running that? we all right? Okay, because, a lot of times, guys, I've been doing this stuff for so long, I just kind of have a good time just kind of talking. That's what I was telling you. If you have a question, please, like Mr. Day, just raise your hand and we'll try to answer them up. Now, limitations in cognition requiring restricted driving. That's kind of sort of the things that I've been just telling you about. So once I can pick that up, and I'll tell an individual, once I take that minimal state exam or the Montreal as far as they go, depends on how they score, then I can say, well, sir or ma'am, I just confirmed your diagnosis with the doctor. Now, I don't even know your doctor, who your doctor is, where he or she's located. But I can tell you one thing, when I look at the number, I can tell why that doctor made that diagnosis. Don't even know what kind of testing they did. And by and large, they usually do the mini-mill clock or Montreal cognitive assessment, okay? Now, DMV really and truly, I mean to tell you, my son just told me he was, like I mentioned earlier, he was up in Baltimore Wednesday, and he's just he's in such a tit with the MVA, Motor Vehicle Administration, same thing as DMV in Maryland, because they are just off the chain. Here in Virginia, and I'm going to tell you, the Virginia DMV Medical Review Service section is without question the most thorough, most comprehensive, most everything in between with regards to keeping individuals safe, okay, based on a medical condition, which could include, the aging process, et cetera, et cetera, et cetera. So see, look at this. Some of the conditions that require the DMV review process. Dementia, we mentioned about these CVAs, or stroke, transit ischemic attacks, seizure disorders, traumatic brain injury, multiple sclerosis, Parkinson's, and we see a lot of individuals with Parkinson's disease in the aging population. In fact, we have been, gosh, I can't believe this, but we've been involved. I don't know if you all have heard about the Grand Driver program that the state of Virginia has. Well, it's a grant that they have, and they usually let the grant, well, we get the word around about the latter part of December. And it usually, for an example, we just finished the thing, gosh, well, it ends September 30th, actually. But we finished ours back in May. But what it is, it's a program that assists financially the grant to help defray the cost of the evaluation, because, evaluations can be kind of expensive, okay? But what this grant does, it defrays, again, the cost. And in some cases, individuals don't have to pay anything because the grant will take care of the balance. And it just depends on, and we use the federal government sliding scale to determine just where they are with regards to their yearly income. So you're either above the line or below the line. Now, if you're below the line, $0. Now, above the line, we can give you a really good price. And it's a really, really good program. But the thing that I've seen over the last few years is that the numbers of individuals with Parkinson's disease, seizure disorders, stroke, and obviously dementia, numbers are really shooting right through the ceiling, okay? And it's a really good program because, again, it helps defray the cost for individuals on obviously fixed income, okay? Don't see too many spinal cord injuries, although I do now have an individual down in Portsmouth who's actually 79 years old, quadriplegic. He's designed to drive again, okay? So we got to help him right along, and we can make it happen. Now, again, diabetics, we don't see too many type 1s, but we do see quite a bit of type 2s who are what? Insulin dependent. And in that case, yeah, we got to adhere to that policy. We're also seeing an abundance, which kind of goes along with the diabetic issue, individuals who have amputations, okay? In fact, I've got a gentleman who he's up in Richmond, and he is actually 91 and desires to drive again. And guess what his problem is? Bilateral lower extremity amputations. And he walks with prosthesis, okay? And what's so neat about the DMV, they just, well, maybe not just, in the last year, they would allow an individual to drive using a prosthetic device, okay, if it's below the knee. And the reason for that is you can control it better if it's below the knee. Now, if it's above the knee, that means you got more prosthesis and it's a little bit more difficult to handle, which is a really good thing because I got a lady down in Portsmouth. She's a bilateral low extremity amputee and actually walking on prosthetic devices, okay? So when I told her what our fee was, we didn't have enough, well, we didn't have any more slots for the grant. And she said, well, John, I might as well just throw, I might as well just throw in the towel. I said, wait a minute, you don't have to do that. I said, let's try this. Try driving with those prostheses on from the right side. She did it, and after we did it the first time, she said, John, how did I do? I said, I don't know. How did you do? And in fact, her confidence had really just bottomed out, excuse me. But she's able to now drive using a prosthetic device, using the conventional gas and brake without what? Incurring the cost of what? Hand controls or left foot gas pedal. And let me tell you what, that stuff can cost quite a bit of money. So anyway, she's going to be getting the evaluation done $0, and it's going to be $0 in regards to the equipment that she's going to. So let's see, macular degeneration. Now this is one that's interesting. They kind of come and go. I've seen probably 3 or 4 in the last month. In fact, as I'm getting ready, this was about, about 5 minutes till 11. This lady calls me, and she had called me before, and she said, John, the DMV suspended my license. I said, why? Well, I don't know. I said, well, let me call and find out what's going on. Well, when I called, excuse me, when I called, because of her macular degeneration, her visual acuity did not meet the state standard. Automatic suspension. So now she's wanting to appeal that process. And she said, well, John, do you think I got a chance? I don't know. You got to appeal and see, Well, she said, I know what my visual acuity was before. It was 20/80. Well, you need to be 20/70. So she may make it, and she may maybe she go in and just kind of sweet talk, but I don't really think that she make it. And guess what? Okay. And guess what? She's 85. And she wants to drive again. And I can understand that, but she's just got that. What was that question again? You were saying that someone, a responsibility. Right, that's exactly. I mean, we're talking clear across the board now, not just visual issues, but you have some people with cognitive issues, you have functional limitations. I mean, again, everything clear across the board. They do have that responsibility. For an example, I spoke with a dad this morning with regards to his son. I was telling you about the one who had the traumatic brain injury. Now he's telling me, Dad is telling me that the doctor does not want to have any involvement from DMV. And I said, right. And I said, sir, I mean, I hate to tell you this, but the doctor is flat wrong. And when I say that, it's because, in the doctors in the house, the doctors need to stay in their pay grade, in their lane. I talked to the folks at DMV, I'll guarantee you, I haven't talked to them today, but it's just almost 12 o'clock. I talk to them any number of times every week. So if it's anything new that's coming down the pike, guess who's gonna know about it? Me, or my son, or somebody like us. So what is our job, and I spend more time than I really want to, but I got to do it to bring the physicians up to speed. It's like, I don't know if you were in, Ms. Davis, when I was mentioning about the ophthalmologist that I talked to a couple of weeks ago, in a number of stroke patients, that he was a little iffy on making referrals or reporting these individuals to DMV. And I told him what the rules are. And he said, well, thank you, John. Long story short, once the medical community find out who we are, we can't get rid of them because we are taking that responsibility off of them, just like I did with this ophthalmologist. And I could just go on down the line. I mean, I've had any number of conversations, neurologists, ophthalmologists, primary care physicians, nurse practitioners, the PA, all across the board. When I was at the VA, I'm telling you, I just traveled across the country doing talks to medical communities. I mean, it was really nice, getting across the country. But it amazed me as to how little they knew about all of these policies. In fact, I carry a binder with at least every policy that the DMV has, at least to the date, okay? And something might be coming down the pike of which I don't know about, but I carry them, and I carry them for the express purpose. Somebody's gonna challenge me at some point in time, Sean, why do I need to follow this policy? I've been driving for 50 years. I've been all over the country. I drove in Europe and Africa and everywhere else. Why do I need to do this? Well, I open my binder up and say, you see this? It doesn't have John's policy. It doesn't have your policy. It's a DMV policy. And that policy was established by the DMV Medical Advisory Board, which is a team of 15, a cross-section of 15 doctors, which they bring all this stuff together. And guess what? It's for the safety and protection of the consumer. And I mean, I carry it, and and my son carries it too, because again, and I don't mind being challenged because I know what I'm talking about. And if I don't, guess what I'm gonna do? I'm gonna get on the phone, okay? And the other thing about it is most of the time I don't even have to do that because most of the stuff, I've been around so long, most of those policies I helped them to develop in the first place. Yes, ma'am, I get to you. Anybody. In other words, if Joe lives down the street, or Mary lives down the street from you, and you're seeing that they're driving erratically and doing some not so safe stuff, you can do it. Now, what will generally happen is when that happens, the DMV medical review service section, now you got to have some information, obviously, so that they can identify the person on their record. And when that happens, they're going to get that what? That nice little letter in the mail that your license has been suspended. Because I've had any number of folks come to me and said, John, I don't have anything wrong with me. I said, well, it must be something because guess what? The DMV suspended your license. And see, and that's the only population that we deal with, those individuals who have a medical issue, okay? So yeah, anybody can do that, okay? But most people don't want to do it, including the what? Medical community, because they know and think that, gosh, if I report Mr. or Mrs. Jones, they're gonna fire me. And I've had individuals that tell me that. John, my doctor reported, I know he or she did it. I'm not going back to that doctor. I'm going to find me another doctor. Right. Then that's when I have to let them know because the medical community, they know what they know, which is the doctrine. And like I said earlier, that's what they need to do is stay in their pay grade. And that's why I was saying again, and that's why they'll do what? They'll call us up in a heartbeat because I can tell them what they don't know. And that's the thing that like I said earlier, I spent a whole lot of time doing that, but guess what? I got to do it because they don't know it. They're just telling information or their patient's information that's not true. And just like the gentleman I was telling you about, the son that I talked to this morning, this was certain, if you decide that you and your doctor do not want anything to go to DMV, now I can do the evaluation, but guess what? I'm going to make it as a matter of record because it's not me that's going to sit here and take the responsibility of seeing someone who has what, dementia, Alzheimer's, Parkinson's, or whatever the case may be. I'm not taking that responsibility when I know beyond a shadow of a doubt that the DMV's got a policy. And that policy will state that, for an example, if somebody has any kind of cognitive impairment, they must take the entire sign, general knowledge, and driving skill sets. It's not any, no, I'm thinking about you must, okay? And again, that's because that is for that person's what? Protection. Did I answer your question? Yeah, but what would happen? They will get that information, for an example, from yourself who just reported a neighbor, right? Right? Now, the next thing that happens, that person is going to get a what? Letter in the mail saying that you are now suspended because, see, they don't know what the situation is, okay? And I hate to even say this, but a lot of times what they'll do is look at what? Somebody's age and say, oh, okay. And we know what happens when we get older. Unfortunately, things start, you don't necessarily have to be old, but the probability of things happening is pretty high, right? So then they're going to suspend you and say, sir or ma'am, you need to go to driver rehab because what they need is more additional information. Now, once that assessment is done by a certified driver rehab specialist, no matter what it is, it could be limb amputation, it could be that, it could be some cognitive dysfunction, could be any number of things. Now, once we do that evaluation, the next thing that I'm going to tell that client is, sir or ma'am, because we'll just say the person had a stroke. Now, because that person has had a stroke, we've got to get the primary care doctor involved to cover the medical side of the house. Then we've got to get what? The eye care specialist, which could be ophthalmologist, optician, et cetera, because we know that a stroke can also affect one's vision. Now, once that is in, my report is in, so see where we are now? Now the DMV knows what's going on with this individual, all right? So now with my report, see, I'm addressing the driving side of the house, okay? Now I'm gonna say, just for conversation purposes, okay, Mr. or Mrs. So-and-so has some right upper extremity hemiplegia. In other words, you can't use the arm at all, or there might be some hemiparesis, but they can use it a little bit. So now we're going to say, all right, sir or ma'am, to get you to drive safely, we don't see really any significant cognitive issues, but we do see some what? Function. There's a little bit of paralysis. We can solve that easy by, anybody remember what old steering knob, old suicide knobs are? You all remember what that is? It's a knob that attaches right onto the steering wheel. And yeah, there you go. And it helps. Back in the day, I mean, the guys used to have them. I mean, they would have them on the left side of the steering wheel, and the significant other would be what? Embraced with the right hand, right? But the thing was outlawed because people were ended up having an accident. They were breaking their fingers because when that wheel started spinning, if your finger get caught in the wrong spot, it could clip that baby real quickly. So the only reason why you can use any adaptive aids now is for medicinal purposes. So you see where we're going now? So that person that we're just describing that just had that stroke, who has some hemiplegia, some kind of functional limitation that might need some adaptive equipment. Now, see where we are now? We're saying that this person now is safe and independent in driving, and we're just saying, generally speaking, with that equipment, because obviously with the one hand, it's going to be obviously what? Very hard to steer and engage all of we call the primary functions, which is steering, and putting the car in gear and start it up. Secondary functions would be anything that is on the dashboard. Okay, the radio, the air conditioning, stuff like that. Now we can solve that too. But so see, once that all happens, then that individual will have to take a what? DMV driving skills test, because now that person has to be what? Authorized to use that steering knob. Then we're good to go from that point on. Because see, what one doesn't want to do is to have a particular medical situation and guess what? Get out there and get involved in an accident. And as I said a little bit earlier, when you get into that senior population, the first thing that old Philadelphia lawyer is going to do is what? When they're trying to build their case, I mean, it's pretty easy to find out if a person has a license because all they got to do is just confer with state's DMV office. Then the person, the Philadelphia lawyer is going to say, well, look, what can I do now to build my case? They're going to look at that age. And like I said earlier, we know, unfortunately, that as we age, stuff starts to happen. And then, bingo, that doctor is going to subpoena that person's medical records. And now you remember we were talking about the CVA stroke person there, right? So, or if it's dementia, same thing, okay? So once that Philadelphia lawyer finds out that there's some what? Cognitive issues and also some what? Functional limitations that might be an issue, the lawyer's going to say, oh, I got you now. Flipping the script, talking about that same stroke person now. Philadelphia lawyer confers with the DMV, says, oh, I'm calling to find out just what the license status is for so and so and so. Okay, license number, et cetera, et cetera, et cetera. Oh, yeah, we got this individual medical review services now, not just your general DMV, okay, field office. So, oh, yeah, we know who this person is. And by the way, this person has gone through driver rehabilitation. They've gone through, or at least they're addressing the policy of which is the DMV stroke policy. See, there's a stroke policy too. See? So we know that that person needs a steering device to help them steer because they may have, hemiplegia, hemiplegia on one or the other upper arm. So you see where we're going here now? Now the Philadelphia lawyer's gonna have to say, well, I tried. But what you don't want to do, because I tell people all the time, we can talk all the smack about DMV all we want. But DMV is the licensing authority of the state and not the physician, and even not John. Even though, see, some folks come and say, well, John, can I drive? I said, well, your license is suspended. Now, what do? I can get that person reinstated. And all it is, the DMV allows us to what? Reinstate people, okay? And that's easy because I got a standard form that says, this person is enrolled in driver rehabilitation, secondary to being diagnosed with dementia, stroke, whatever, seizure disorder, whatever the case may be, okay? Now, we are requesting a 3W restriction. Well, what the heck is that? That person can only drive with me. Now, see, if DMV is going to that extent to have us to do what we do, it must be something to it. And it's all kinds of things that we can do. So now, once we get that person reinstated, the next thing that's going to happen is obviously I got to evaluate. Now, once I evaluate them, then I'm going to go through the process of seeing whatever the problem is. Either not, it's either going to be visual, cognitive, or functional. Okay, and when I address all of that, and then I'll say ultimately, just like we were talking about the person with the CVA. Okay, this person can drive, but it must drive with a what? Steering knob. All right. My report goes into the DMV, and that person is notified, well, sir or ma'am, you need to go to DMV and take a driving skills test with that what? Steering knob. Once that's done, then that person is what? Authorized to use that particular piece of equipment. And that goes across the board. Let me see. Yeah, I think you, and I'll get to you. Yes, ma'am. Let me have it.
If someone gets a letter saying they're suspended, are they given information referring them to you?
Well,
I mean, what are they told are their options?
right. They are told, number one, your license is suspended. I mean, that's just the way they roll. Now, at the same time, what they do is they will issue a listing of what? Every certified driver rehabilitation specialist in the state of Virginia, which is last count, I believe it was 15 of us. Okay. And then the consumer has the what? Authority, the privilege to what? Employ whoever they want to. But guess what? In the Eastern Virginia, Central Virginia, and Northern Virginia area, my son and myself, in Northeastern North Carolina, 0, because now I'm told this by a vocational rehab, specialist down in Elizabeth City. The closest driver rehabilitation specialist to them is in Greensboro, which I was told that it was about a 5-hour drive. So that's now because Greensboro, it must be. Yeah, because I do know there's one over at Duke. Okay. Yeah. All right. But see, the whole idea is that we do a lot of traveling because, I mean, you can about imagine, hey, if you got somebody who has functional limitation, I mean, you got to get that person from point A to point B, but they might be in Carolina. I'm saying, well, look, I'm in Richmond. So you got to come to me and my clinic, which is in Richmond. But no, it's easy for us to what? Jump in the car and just go to North Carolina or all those other little spots that we got. Okay, good grief, I just completed. But anyway, let me just show you how much, Kenzie, how much time we got? About 5 minutes. See, now look at this. This is a list of medications that requires a DMV review. Now watch this. We know what the codeine is. Depakote, usually for seizures, as Dilantin, insulin, diabetic. Look at the Keppra, MS, Aricept. Guess what that's for? Memory. Amenda. Look at this one. Memory. Look at the next one. Oxycodone. Like I said, folks, I've been doing this for 40 years, and I'll guarantee you I've seen more folks on oxycodone in the last 5 years than I have in the previous 35. But it's a class A, class 1 prescription. So which means is a lot of people are abusing it. Okay? I mean, it is gone crazy. And I think you mentioned something, ma'am, about people who own substance abuse. We're not just talking about alcohol. See that list? Look at that list. Most folks don't even know that even exists. Okay?
I have 2 questions.
Okay.
The first question is, you've mentioned the responsibilities of physicians to report some of their patients to DMV. Let's say the patient has an accident while on a certain drug or with a certain condition. Might the physician who doesn't report that patient be somewhat liable for that accident? Just thinking.
Yes, ma'am. And let me tell you, this is way back in the day when I first got started. I mean, you know, at the VA now. Oh gosh, they march to the beat of a different drum. And I would tell doctors, the doctor so-and-so, you know, we need to get the DMV involved. It's because of so-and-so and so-and-so. I've had more conversations with doctors. And you know what my final word to them would be? Well, doc, would you rather to get sued for doing your job or not doing it? Now, I'm not the doctor now, but I'm just telling you what I know. Now, why would DMV have that medical advisory? And every state in the United States has a medical advisory board, every one, okay? Now, why would they go to that extent to having a medical advisory board and then having a medical review services section? Why is that? And I can tell you right now, they said it earlier, that the DMV in Virginia, let me tell you, they don't play. They do not play. They'll do everything to help you, but guess what? If you come and you don't bring what you need to bring, you know, the old saying was, if you're up the creek without that paddle. Your second question.
Well, the second question I had was, let's say that your license is suspended.
Mhm.
With that letter, does it provide other options for the person to use, like Uber, like, what's the other service?
Lyft and
Lyft.
yeah. See,
Like, I know there are grants for
right.
transportation
services,
places.
Right.
A lot of times people
No.
are desperate because that's the only way they know to get around.
Absolutely.
But if they know there's other options for
Right.
them to use, maybe they wouldn't push so much
Right.
to drive.
That's a good question. Now, what we've had to do, we've even had to come up with a listing in the various locations of alternative forms of transportation. Because I mean to tell you, it's it is what it is. Sometimes it amazes me as to what people don't know, but everything's not for everybody. So when they do get in a situation like that, that's exactly what we had to do. Come up with an alternative form of transportation. And we didn't have the Lyft and the Ubers because, you know, that's a little bit more costly. But at the same time, the transportation services, guess what? It's costly too. Guess what? This is 22, this is probably, pre-COVID. I had this individual who was a nuclear physicist at the Newport News shipyard, lost both of his legs. And guess what he had to do? Previous to having his legs amputated, he drove himself to work. But now he's got to do what? And I forgot what the service was, but it was one of the transportation companies, the paratransit services. He said, John, I've got to be to work at 8 o'clock. He said, man, I am ready to go at 5:30 because I don't know when the van's gonna get me. And he said, at the same time, I usually like to work a little bit later. I mean, he's really into his doing whatever a nuclear physicist does. And he says, a lot of times I'll stay late. He said, I can't do that anymore. So I got to drive, man. Can you help me? I said, yeah, I can help you. So anyway, long story short, he ended up driving with hand control. And when the man passed his road test, he said, John, I really want to kiss you. I said, no, hold up. He said, but that's all right. I'm going in the house and I'm going to just take a dance, kiss my wife, and then we going to dance. I said, yeah, you do that. So, but that's what, yeah. So, yeah, we have that list that we've got, and we had to do it for that express purpose. Sorry for the dancing around here, but we got several more slides. But anyway, we've been told that everything is done. But, you know, like I said, usually that's the way that I like to do it. Because, I mean, gosh, I don't want to read stuff to you. I like to just be personally involved and interactive, you know. So that's about my story. But what I wanted to show you real quickly here is we were talking about the adaptive equipment. Look at that right there. Kind of really picture. Let me tell you what, the technology has gotten to the point now where 40 years ago, a person who needed that much equipment would come to me and I would say, sorry, sir or ma'am, but I really, I'm impressed with your enthusiasm to be wanting to get back behind the wheel, but I just don't have the equipment to accommodate you. Look at that. In fact, I had a young girl over in, this is the same, look at this. And I had a young lady over in Smithfield. Gosh, it's been almost 10 years ago. She had a severe form of arthritis. And as a teen, she was able to ambulate somewhat grudgingly. And as she grew older, she finally was confined to a wheelchair. And she graduated from, was it Christopher Newport? Yeah, Christopher Newport. But anyway, by this time, I come into the picture because the parents wanted to what? Young lady has a BS degree. Man, you need to go to work. So how you gonna get to work? the Lyft and the Uber and the transit, that's not gonna really help. So anyway, she was picked up by the Department of Aging and Rehab Service, which is a state agency, super, super good organization. But anyway, long story short, she needed exactly what you're looking at right there. See what her right hand is? That's one of the steering devices that a person can use. It's called a tri-pin. And as you can see, unlike, say, a spinner knob, you have to add some hand grip strength. But here, you can just place your hand in that tri-pin, and we can adjust it to kind of tighten it up around the wrist, and a person can see it. But you can do that for what? Both sides. See, one is on the left side, one's on the right side. Okay, so the one on the right side is obviously for steering. Now, her left hand is going to be doing what? The steering. So then you say, well, okay, now how in the world are you going to engage your turn signals, your lights, your horns, et cetera? We call that secondary function. See those two rear posts? The one that's up on her sleeve? All she has to do is rotate her wrist. And it works on a musical octave, do, re, mi, fa, sol, la, di, do. So each function each sound is a function. So if you want to make a left turn, do, re, boom, boom, 2, horn, might be 3. That's how that works. And then she's obviously also in the in the right hand, that's how she accelerates and brakes. Now, she's obviously in a van. So that means now she's got a modified van that's got a ramp on it. And she's obviously in a wheelchair. And all she does is come up the ramp, pivots around to the right down into the driving position. The thing locks down. It's a floor mounted power lockdown, it's called. And the seatbelt, you see the seatbelt is already engaged. And in fact, I got a lady up in Richmond, and I was telling her the other day, I said, all you got to do is just take but what she has is a steering knob. We'll wrap that seatbelt around the steering device. And all you got to do is ride up into it and then unbuckle it or unloosen it. And then the seatbelt will retract and you're good to go. Now watch this. And I know this for a fact because I had to write out to the state Department of Aging and Rehab Service the complete listing of everything that this young lady needed. The grand total came out to be $89,000. Now watch this. The state is not responsible for buying the vehicle because you can't have all that equipment and not have a vehicle. So this was, as I remember, it's probably back in, 2009. No, there had to be 10 or 11, somewhere back in there. So the parents went out and bought her a Dodge Town and Country. So we'll just say it was maybe a 2012 or something. You can about imagine that was probably somewhere around $25,000, $30,000. Do the math. 89 plus 25 and 30. All right. So thank you guys and appreciate it. Hope you were able to, be able to go away with something that I've said that can help you along the way. So thank you so much. Really appreciate it.